Hi, I'm Larry Ahrens, here with another conversation about cardiovascular health with Dr. Harvey White. Dr. White is the founder and executive director of Vessel Health here in Albuquerque, New Mexico. Good to see you again.
It's good to see you, Larry.
Good. My veins are working, I think. That's good. And we're going to talk about the whole vein system in your body.
You know, vein problems in America are 3 times as common as arterial problems. And so at Vessel Health, in which an organization in which we focus on the vascular system, we think it's very important to talk about vein health. So I thought that perhaps we could talk a little bit about the vein system.
Sure.
We could talk a little bit about the kind of problems it generates. And then perhaps if we have time, we can talk a little bit about how we take care of it.
You bet. Okay. The system itself, if it's working great, you should feel no pain, right?
You know, it's a mystery system. It's under-attended to. Kind of like a middle child or something like that. But let me tell you, I brought my chalkboard again here, Larry.
Okay, good.
I'm going to divide this conversation about the vein system into 2 parts.
Okay.
One has to do with the system as it returns blood to the heart. And that's what the veins do. They bring blood back to the heart. And you know, the blood that comes back to the heart does not have any oxygen in it. So it's blue. And I have a blue marker here.
Okay.
But this is the heart as I've drawn it in a very schematic fashion. And it includes what we call the atria and the ventricles. And these chambers of the heart, you know, beat in sequence. The blood returns, and you saw this picture a little bit before, in a vessel called the vena cava. Comes to the right atrium, goes to the right ventricle, out through the lungs, back to the left atrium, the left ventricle, and out into the body in oxygenated form with oxygen. Well, this vein system, which brings blood back from the lower extremities, it involves a bifurcation or division down here with a vessel that goes down each leg. The problem in most instances with vein issues or vein conditions is below this level. There's a vein system that comes from each leg back up to about the belly button and then up to the heart.
Okay.
I drew this here, vein of the right leg, to show that there's 2 main branches. One is a deep branch that courses next to the bone in the leg, and that actually is rarely a problem. It can cause or be the locus or focus of a blood clot that we might have after an airplane ride, and I want to talk a little bit about that. But the problem that we see mostly in America and the civilized world is a vein problem that involves the superficial vein that courses on the outside of the leg or near the skin.
Okay.
And we call this the greater saphenous vein. And it, interestingly, and I know this is a long anatomy lesson, has a valve up here. It's a one-way check valve. This check valve has a couple of leaflets that move, and they should look like this. That is, do you understand? They should let the blood back up to the heart and not back down to the feet.
Okay.
Well, in certain people that might have a family predisposition, someone who's on their feet often, a person who's had pregnancy in the past, or one who's perhaps had a blood clot in the past, this valve can become non-functional or dysfunctional. And in that instance, and I apologize for drawing this again, the valve leaflets or little flappers don't touch each other, and the blood goes up to the heart and back down towards the feet.
It backwashes down. Yeah.
Exactly. This is a check valve, and it does not work in a number of patients in America. So this is the beginnings of the problem, and I'd like to spend another session perhaps telling you how that might cause issues down the pike.
Okay. If it gets damaged, can it be through an injury too?
It can, and we've had patients come in after a motor vehicle accident. I had a patient the other day who was in a motorcycle accident. So one side had become a problem up here, and he, in this instance, a male, had varicose veins of one leg.
Where in the body is this little valve system?
The main valve, interestingly, Larry, is right at the groin, or where the crease is in your leg when you bend your leg. And as you can imagine, because of that flexion point, it is a little more prone to injury. There are some other valves, though. For instance, there's a couple of valves that connect the deep and the superficial system down, particularly in the calf. And those valves can also leak, you might say, and permit pressure to come from the deep system back into the superficial system. This creates a problem that we call venous hypertension, or excessive pressure in the veins. And the veins are very much like a garden hose as opposed to a hydraulic hose. They're thin-walled, they dilate easily, and they can cause problems.
What's that feel like if I'm having problems with one of the valves there?
It can be cosmetic, that is, it can be seen visually, etc. But people can develop symptoms, that is, subjective feelings, particularly heaviness in the legs. Night cramps or restless legs can often be due to this. Because what happens is the blood goes back down the leg. It doesn't go the direction it should go, and the leg becomes swollen. Maybe not conspicuously, but enough so that the person's leg becomes uncomfortable.
If you'd like to find out more, and this is certainly something that Dr. White can talk to you individually about, you need to talk to him at Vessel Health right here in Albuquerque. The number to call over there, Dr. White, is?
That's a 505-828-3000. And Larry, we also have a website. The website is www.vesselnm.com.